Everyone, this week I will be discussing adolescence and behavior disorders. And according to a anger management resource article on adolescence, adolescence is a time of transition from childhood to adulthood, from freedom to responsibility, and very few of us make it through that unscathed. Research has identified both biological and environmental causes for behavior disorders. Today I will inform my audience on a few various types of behavior disorders adolescents may face, as well as why they occur, and then also types of treatments that they may have to go through. Young people can have mental and emotional and behavioral problems that are real, painful, and costly. These problems, often called disorders, are sources of stress for children and their families, schools, and the greater community. As someone who has worked with children and adolescents who have struggled with disorders, I feel as though I have that experience in this area, as well as kind of collaborating with different colleagues. I've already been exposed to working for a county, so I feel as though I've been able to obtain some great information from them as well. And then also conducting my own research over the last 4 years of going back to college. So, according to Disruptive Behavior Disorders Within Children and Adolescents article, children may face a risk, if they are rejected by their mothers as babies, separated from their parents, and not given good foster care. Physically or sexually abused, raised in homes with mothers who were abused, or living in poverty. Some of those are examples of why children might occur these disorders later in life. So after hearing my speech, I would hope that those of you who have children or know somebody who does will recognize the importance of encouraging those struggling with behavioral disorders to seek the appropriate treatment in order for them to live a happy and healthy life overall. So in my speech, I will inform you about the varying behavior disorders, which will be 3 of them, and then why they actually might occur in some adolescents and why it doesn't in others, and then also finally the option treatments. So with that being said, first we'll discuss 3 types of behavior disorders that can occur in adolescence. There are 3 common behavior disorders found among adolescents, which include attention deficit, hyperactivity, ADHD, depression, and then oppositional defiant disorder. Attention, to start things off, attention deficit hyperactivity disorder, ADHD, is among the most common behavioral disorders in childhood. There's 7.8% of kids that have been diagnosed with ADHD. Many children and adolescents are now being treated nowadays with medication. Some go for therapy, but primarily medication. Youth depression is a chronic and recurrent condition. Many youth have a risk of depression coming back within years to come down their future. So according to Magna, there is 50 to 70% likely to develop a further episode within those 5 years, particularly if they have not been treated. Depression can be kind of a controversial issue out there because there's different medications and things like that that have the warnings, that it could actually make the depressed child or adolescent worse than what they were before. So I think that kind of a little controversial issue there. And I guess it's kind of up to the doctor, whoever is seeing that child, as to what the best treatment would be for them. Then finally, with the oppositional defiant disorder, many times you'll see these kids engaging in dangerous, risk-taking behaviors. They have a difficult home life a lot of times with parents, and they have poor social support group for the whole family in itself, and then also poor coping skills. When things are not going their way, or things are kind of getting out of control, they have a hard time kind of reining that in and coping with the difficulties they are facing at that time. If your child or teen has a persistent pattern of tantrums and arguing and kind of have an angry, disruptive behavior toward you and authority figures, that kind of points in the direction of oppositional defiant disorder as well. So now that we have discussed those 3 types of behavior disorders that are the most common in adolescence, we're now going to talk about the reasons as to why these disorders occur in adolescence in the first place. So although not discounted as a factor for the development of disruption, currently there is little evidence that actually points to genetic reasons. There's nothing exactly substantial information out there that points in the direction of genetics being a reason as to why these could occur. One could obviously argue the depression, though. So, large emphasis is also placed on that disruptive behaviors kind of converges due to the environmental factors that are in their life. So with that being said, where they're living, if they're living in poverty, as I mentioned before, and then kind of that poor social skills also. So it could be the school, the greater community itself. There's just not a lot of positive outlets for them to seek. So, and then third would be the kind of parental psychology of what the parent is going through. Sometimes they have their own mental health issues as well. So there could be the poor family functioning. And then dysfunctional parent-child interactions as well. And then child abuse is one factor that plays a part in the disruptive behaviors of children as well. Finally, given the concerns regarding behavior disorders adolescents face, I will now discuss the types of treatment that may be helpful for particular adolescents. Treatment is a crucial step towards a recovery for adolescents struggling with behavioral disorders. This is how they're going to learn those coping skills that are very important. And then also if medication is necessary, they can have something, that would be best fit for them as well. Clinicians should develop an individualized plan because everybody is different, every child is different. So you kind of have to have this plan based on what's going to fit the best for that child. Intervention should target the behaviors and what has been evaluated as being dysfunctional. So parent interventions also is recommended, especially in that evidence-based program that's out. So it's so important for families to be together as a whole and to work towards goals together and tasks together. If you have one that's not on the same page, it kind of throws a wrench in the whole process of treatment for adolescents. So it's very important for the whole family to be on board and to be working towards those goals together. And then depending on the severity or persistence of the disruptive behavior, some children might have to be treated in a hospital setting if that's necessary. Obviously, only if that is going to be necessary or not would be determined by the doctor or clinician, whoever is diagnosing the child as well. So in summary, adolescents' behavior disorders are conditions in which there is a need for appropriate treatment in order for the individual to live a happy and healthy life. These varying types of disorders are treatable with the proper type of diagnosis and treatment plan, and which obviously has to be individualized, which is key. Since we have discussed the specific types of behaviors, the reasons why a behavior disorder can occur in adolescents, and then the best way to treat them, hopefully individuals can go out and help their loved ones who are suffering with these type of disorders and make sure that they get the proper treatment. So I hope that all of you will be able to take some information that I was able to give, and if you know somebody or if you are struggling with an adolescent with behavior disorders, hopefully you can kind of step out and guide them in the right direction, and so that they can live a happy and healthy life as well. So as someone who's worked with adolescents struggling with this behavior disorders, I can account to the fact that they are often in need of some kind of help, someone to just go to vent to, a confidant to, have a good positive relationship with. So if you can do anything of that kind of nature would be helpful for those kids who might be struggling with behaviors. So remember, in these troubled, uncertain times, we don't need more command and control. We need better means to engage everybody's intelligence in solving challenges and crises as they arise. All right, thank you.